Hi there, I'm Dr. Karen Leggett, the Women's Midlife Specialist, and today is part 3 in recognizing the signs of hormone change. If you didn't see part 1 or part 2, I encourage you to watch them. In part 1, I talked about sleeping problems, fatigue, and brain fog. In part 2, I discussed urinary leakage and incontinence, low sex drive, and migraine headaches. So let's hop right in on symptom number 7. The 7th sign of hormone change you should be aware of are skin and hair changes that occur as our hormones change. Estrogens affect skin thickness, wrinkle formation, and our skin's moisture. Estrogens increase substances called glycosaminoglycans. Hyaluronic acid is an example of a glycosaminoglycan, which helps retain moisture in your skin. Estrogen also increases collagen production in the skin, which helps with the thickness of our skin. Together, glycosaminoglycans and collagen help keep our skin plump, hydrated, and wrinkle-free. As our estrogen levels decline, our skin gets thinner and drier, and we notice increased fine lines, wrinkles, and the appearance of less fullness. Estrogen also helps our hair grow, appear healthy and nourished with moisture, just as it does with our skin. Unfortunately, if you experience a sudden drop in your estrogen levels at menopause, you may also experience a usually high amount of hair loss all at once. Hair loss can also occur in some women due to an imbalance between testosterone and estrogen levels, with the ratio of testosterone being higher than normal. This results in excessive hair loss and is called female pattern baldness. Fortunately, proper balancing of sex hormones will help you glide through your midlife years and decrease the effects of these skin and hair changes. In addition to balancing your hormones, you can also fight wrinkles, thinning skin, and dryness by using exfoliating and moisturizing products that contain retinoids, vitamin C, palmitoyl tripeptide 38, and palmitoyl pentapeptide. Some people enjoy using essential oils on their skin, such as rosewood oil, jasmine oil, carrot seed oil, and rose hip oil, which will boost external antioxidants, increase hydration, and improve the lipid barrier of your skin. And as a reminder, stay away from excessive sun, alcohol, and smoking. The 8th sign of hormone change I'm going to share with you today is dry eyes. Dry eyes are very common in women as our hormones decline. Though there are many causes of dry eyes that are not hormonal, about 60% of postmenopausal women will experience dry eyes due to declining hormones. Historically, it was felt that the decline of estrogen was the main cause of dry eyes in women, since women by far outnumber men with this condition. However, it is now known that a decline in testosterone and likely DHEA are the main hormone culprits for dry eyes. However, with that said, it is also felt that it is not just the declining testosterone and DHEA, but instead a balance between estrogen, progesterone, testosterone, and DHEA that causes this condition. This supports the fact that when we talk about balancing hormone benefits, we need to consider all of our hormones and not just isolate 1 or 2 hormones. Hormone treatment without testosterone has not helped this condition, and in fact, hormone treatment without considering testosterone and DHEA balance can actually worsen dry eyes. Treating with hormones will require balancing all of your hormones. Additionally, natural treatments for dry eyes include the use of lubricants or artificial tears. You want to use your artificial tears multiple times a day, starting when you first wake up, during the day, and then before bed. My favorite brand is called Refresh. which comes in both a single-dose vial and small multi-dose bottles. I like to carry these single-dose vials in my pocket, purse, and coat jacket for use any time of day. A multi-dose bottle such as this will have some form of preservative. Make sure you purchase the smallest bottle that you can so that it stays as clean as possible. Remember that any eye drop that is used to get the red out is not a lubricant and is actually not healthy for the eyes. These drops cause a constriction of blood vessels, and that is how they work to decrease redness. This is not something you actually want for your eyes. Other things that you should be aware of is staying away from irritants and pollutants. Keep your hands and fingers away from your eyes and blink frequently, especially when you are reading and working on your computer. Let's move on to number 9, the dreaded dry vagina. Many women experience a drying of vaginal tissues at different times of their hormonal change. If you are a thin woman, you are likely to experience this at an earlier age than if you are a heavier set woman. This is because estrogen is the main hormone that maintains the elastic nature of the vagina and the moistness within the tissues. Fat cells actually produce estrogen, and so if you are naturally thin, you have a lower estrogen production than women who have a higher percentage of body fat. There are some serious complications of a dry vagina. It is not just about discomfort during intercourse that can be so discouraging, though that is certainly enough to deal with by itself. There is another condition called lichen sclerosis of the vaginal tissues that can occur with low estrogen levels that actually cause scarring of the inner labias and vaginal tissues. And this scarred tissue becomes whitish in appearance, stiff, and loses its elasticity. It is serious and difficult to reverse, and it results in very uncomfortable intercourse. For vaginal dryness, there are 2 main ways to improve the condition and symptoms. First, you should always use a lubricant during intercourse. There are different types of lubricants. I have found women and their partners have particular preferences for particular lubricants. And probably the most well-liked lubricant I have come across is called Eros Body Glide. Eros Body Glide is a silicone-based lubricant and tends to stick around longer. Vaginal estrogen treatment once or twice weekly is also very helpful. If, however, you are concerned that you may have lichen sclerosis, it is a must to see your doctor and plan to use estrogen vaginally and on the external genitalia as soon as there is any sign of its presence. Also use liberal amounts of vaginal lubricants during intercourse as well. Now, don't be embarrassed or quiet about this problem. Be open with your partner and physician and insist that special care and attention be made to keep you comfortable. In some cases, following treatment with vaginal estrogen, the use of vaginal dilators to help stretch the tissues is quite helpful. Wow! Now that was a great review of 3 more signs of hormone imbalance that you should be aware of. I hope this video, part 3 of recognizing the signs of changing hormones, was helpful in some way. Stay tuned for part 4 when I discuss the changes in mood swings, hot flashes, and weight gain. Now, please do me a favor, scroll down to the comment section on this page. Tell me what you think. Give me a thumbs up, share this on Facebook, or just say hi and let me know you're here. And if you think this video can help someone else, feel free to send it to them. I'm Dr. Karen Leggett, and I'm here to empower you with knowledge and confidence so you can make the right decisions for your own health. See you next time.